At the ASCO, I presented the data on the ASPEN study. So this is a phase 3 study in Waldenström's macroglobulinemia, and it is a direct head-to-head comparison of Ibrutinib against the next generation BTK inhibitor, Zanubrutinib. Now, Zanubrutinib is different from Ibrutinib in that it is more selective, so potentially has less side effects, and also the drug levels are higher, so potentially providing a better therapeutic efficacy. So in the ASPEN study, patients are randomized to either receive Ibrutinib or Zanubrutinib, and the primary endpoint were the proportion of patients who achieved a VGPR, or very good partial response, or better. Now, the headline of the study is that it did not achieve the primary endpoint. So the primary endpoint, VGPR rate, was 19% for Ibrutinib and 28% for Zanubrutinib. And that number, although it's numerically higher, did not achieve a positive p-value, which was 0.09. However, when one looks at the investigator-assessed responses, so this is not the IRC, the central responses, and especially when one looks at the investigator responses with further follow-up of extra 5 months, one actually saw that the VGPR rate in the Zanubrutinib has now matured to 30%, and there is now a positive p-value. But because this is an exploratory endpoint, the primary endpoint of the study, which is the direct comparison at the time of the primary analysis by the IRC, so that the trial was regarded as a negative study. Therapeutic efficacy aside, the really interesting thing about this study was, in fact, the direct head-to-head comparison of side effects between Ibrutinib and Zanubrutinib, because Zanubrutinib basically was more tolerable in just about every respect compared to Ibrutinib in a randomized manner. So Zanubrutinib was associated with a reduced number of fatal adverse events, a reduced number of adverse events leading to treatment discontinuation, or dose reduction, or dose hold. And in terms of things like atrial fibrillation, Zanubrutinib had a 6-fold decrease in atrial fibrillation, with the rates being around 18% for Ibrutinib and 3% for Zanubrutinib. Other side effects such as bleeding and diarrhea tended to be less frequent for Zanubrutinib, and hypertension was also less frequent in Zanubrutinib. The one side effect that was more prominent in Zanubrutinib was an increased rate of neutropenia. However, importantly, this did not translate to an increased risk of infection when counted for all infections or for grade 3 and above infections. So in conclusion, this is the first study to compare Zanubrutinib against Ibrutinib. It's the first publicly released head-to-head study of 2 BTK inhibitors. And we saw that although it did not meet its primary endpoint, showing superior efficacy, that there were suggestions that Zanubrutinib may be more efficacious, and more importantly, that the side effect profiles are very different, and that Zanubrutinib is associated with a more tolerable side effect profile.